Okay, Will, can you start us with our land acknowledgement?
Yes. The Anchorage Coalition to End Homelessness and the HPRS Advisory Council would like to acknowledge that we gather today on the traditional lands of the Dena'ina Athabascans. For thousands of years, the Dena'ina have been and continue to be the stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovation, and contemporary perspectives of the Upper Cook Inlet Dena'ina.
Thank you, Will. Roger, would you mind sharing a mission moment for us?
I would not mind at all. As a matter of fact, I have some very positive updates about a couple of members of our community that I've been working with for many years, and two of them that were at Centennial with me, and at the end of Centennial, the one of the young men that I've worked with for so long, who had a substance of choice misuse of fentanyl. I'm happy to report he is now 20 months dry,
Wow.
clean, living with his family in Florida.
Nice.
And that the second one, and I don't want to call him out by name, but that was there with me recently, spent 6 months actually in my spare bedroom so he could dry off of meth. And the two of them have collaborated to get him an airplane ticket to Florida to rejoin their lives as adults.
Oh, that's
and
great.
to move forward with adventures. So we're really pleased for the two of them. And, you know, we do get better.
Yeah,
And
thank you.
so, and I'm sure their story will continue, and I'm looking forward to the rest of it. I'm sure we all are.
Mm-hmm. So has everyone kind of taken a look at the agenda? Do we have any items that we want to add to it, or can I get approval for minutes, May minutes, and the consent agenda?
I'll move to approve the consent agenda and the May minutes.
Do I
I'll
have,
second.
was that Will that second? Great.
Yeah.
Okay, all those in favor? Just
Aye.
wave, right?
Aye.
Was there anything to be added to the agenda? That's kind of the main, before we do the final vote on it. Okay, hearing none, then we will accept the motion and the second for the agenda. So I think I'm up a little bit for a little education, and the one thing that I would say is actually the timing of it is pretty good. That yesterday I participated in the coalition board's meeting, and Jess can attest. I let them know that we had our retreat and that we have a greater understanding of what our role is as a COC advisory board. Maybe they should watch out that we are coming to a better understanding in order to be a consistent provider of services and make sure that the service is being delivered in our community, that we have outcomes and we have various other things, but that we also know how the dollars are being spent. And I also, this morning, the timing, met with the new Region 10 Director of HUD, myself and Robin, who was unable to join the meeting this afternoon, both attended and talked briefly about the role of the COC, the Advisory Council, and our greater understanding and learning, and what are some of the things that HUD could do that help make this a better community. I will say that Meg, both at yesterday's meeting as well as today's meeting, did an amazing job at bringing forth and highlighting some of the real successes that are happening in our community. And I would hope, I actually literally kept a packet, but I left it in my car. But under the ACH report, Jessica, if you could even go over some of the numbers of the people being housed and some of the changes that are happening in our community. I think that one of the things that has become, you know, a glaring thing is that we need to learn how to not only talk to each other about it, but make sure that this narrative goes into our community about the number of people being housed. But yet, while there is need in this area, there's some advancement in these spaces. And so if Jessica, if you can help with that, that would be great. And I'll give you a minute or two extra in order to do that. But I would love for that packet to be distributed to this entire council, as well as, you know, be available. Is it all available on the website? Is that my assumption?
No, in fact, one of those documents I literally made 10 minutes before that meeting. So
Wow.
I will make sure it all gets sent out.
Yeah, it's great information about the number of people being housed. I love some of the advancements that the outreach teams are making. You know, we went through and we saw that there are about 5 different versions of items passed out. You know, now whenever they are at an outreach camp or they're in a camp, they're leaving messages, contact information, when the person will be back. They also have a much more robust list of provisions that they are able to do, from a, you know, the type of kit that you provide in the wintertime, to the type of kit that's a harms reduction kit, to the type of kit that's for snacks. I mean, just really intentional and thoughtful about different needs are met throughout the community, and how as outreach, they can make sure that that information is provided. And so that would be great, Jess. Thanks for that. And other than that, I think any committee updates? I will say that our very own Katie Skovic, that went from chair of our community, what was it? It was called, it's our point in time. No, it's not our point in time. It's our prioritization. Community prioritization is now helping as chief of staff for our current mayor. So we know that she knows our system. So if we ever need to make sure that we have voice in that space, while we do still need a chair for that committee, we do have Katie in the right place. So. And the other committees, Sharon, did we have any data meetings?
No, we didn't meet. And we probably are not going to meet in July either. But what the main thing we would be working on this summer is the metrics, the anchored home, and so there are some committee members who said they'd be willing to work on that outside of a regular meeting schedule. So I'll be reaching out to those folks to try to get us all together and continue to work on it.
And I don't know that we have anyone from the coordinated entry on here. Will. Oh, there you go, Will.
Not on the coordinated entry committee, but you know, I met with Jessica and other folks and about like relaunching the community prioritization committee.
Oh yeah.
And so we got a meeting scheduled for Monday, July 8th at 4 p.m. If anyone is interested in joining that as we kind of restart that work, you know, looking under gap analysis, trying to get a meeting cadence, and diving back into community prioritization.
Thank you, Will, for leaning into that role. Grace or Roger?
I wanted to jump in and just say yes, thank you, Will, for stepping in. For the compliance committee, we've done our first run through over our charter and we've assigned some homework to the members. So we're working very closely with ACH staff. Thank you so much to Jessica and Yvonne. They provided us with a bunch of historical documents on different programs, and we're seeing through reading that information and looking at it with a critical eye, what is appropriate for our scope of work. And so we're just kind of examining the areas of prioritization for us right now, and then we'll be able to present that when it's finished to this whole group and sort of let you guys know what our decision making looked like. We don't know what it looks like yet, as we're still in the research phase. Our cadence for meeting is a little bit more frequent during the summer, just because we're getting started getting these documents up to date. And then we still intend, after getting our charter solid, to begin with our examination with the advisory council as a whole, their governance documents. So those are our big plans. Roger, anything I missed?
No, I think you covered it.
Okay.
Thank you.
And I think those are, I don't see anybody coordinated. Do we know if coordinated entry met? I know that Julia is still traveling, and that is, you know, in Alaska, we don't fault anyone for time off in the summer. I don't know if it has met. I was unable to meet. Does anybody know?
Nope, there was not a CE committee meeting, and then I'm not sure there will be one in July as well, since it the day of the meeting would be July 5th, which is the Friday after the July 4th holiday.
Oh,
So
wow.
we will touch base with Julia and the rest of the committee and find out if they were wanting to either reschedule that meeting or just take July off and come back ready to go in August.
Okay. Are there any other just general updates from members? Any of the work that you're doing, any challenges that you have, or anything that you want to bring forward to this group? You know, Kenny, not to put you on the spot, but I am going to put you on the spot because you've been communicating to me about some great ideas and some resources and various things. And it might be helpful that more people other than me, are kind of fully aware of that. And you have some great questions that I know that I don't have the answers to. And I'm just wondering, as you continue to try to provide some resources, in this community, this might be a great group to bring up some of those ideas or questions to. I think you might be on mute too.
There, how's that?
That's great.
Okay, good, thanks. First of all, I also am excited about the community prioritization. So Will, thanks for stepping in there, and Mitch for helping us get that going, and others too. So I'm pretty excited about that. And then I'm also grateful for Grace too. Grace has been a strong advocate for some of the things that we see that the COC can do, what you guys went over in the retreat too. So I'm really excited. And because of Grace's work, I had a question which I've thought for the last few years, which is, what to do about summer homelessness. And when Anchored Home came out, I was hoping, they're going to have a solution in there, but it doesn't exactly. They do outreach and so on, but there's not a solution what to do with outreach. And so I looked further. It's going, well, then who's going to come up with the plan for the summer, and who has the role to do that? And after I heard about your retreat and the clarification, and just what I read about the COC versus lead agency, that really the community, the continuum of care, from what I understand, is a group that is represented by a broad group and also has a broad view of things.
Mm-hmm.
And so even if the coalition has their limited scope based on their role as lead agency and then some other tasks they do, outreach and a few things, the broad scope of how the community should look at things is really the role of the advisory council, as I understand it. So, but we also have the assembly. They have their committee that looks at things. So they come up with the policies, they come up with funding. And then we have the mayor's office that looks at, health department and so on. And then we have the Homeless Leadership Council, which is not yet functioning. Their original goal was to kind of do what the advisory council did, look at the Anchored Home Plan and so on. So when I look at a leadership group, the best I can see at the moment is the advisory council for overall homeless planning. Now, once we get everyone convinced that that's the way, then we'll do,
Yeah.
like Allison said, we'll have 100 people showing up to find out what the advisory council says we should do next. But in the meantime, I wanted to do, I have a passion for street homelessness. And so the question I posed to Allison and to Eric Glatt and to others is, who is leading and deciding what we're going to do for the summer? And there was no plan other than we'll just do the best we can. We're kind of on just a foot to make it through. And the new administration most likely is not going to look at solutions for summer camping. They're going to be looking at cold weather shelter. And so I don't think anyone had a plan for it. So my thoughts to Allison was, if we were to do something, what would we do? And so I had this plan that had come up with through a council of homeless recipients at Adelaide House that NeighborWorks put on a few years ago. And it was a plan of doing outreach by adopting camps geographically. And so working with community councils, assembly members for their areas. For example, 2 hours ago, I got off the phone with Phil, Pastor Phil from up at the Mountain View Community Council. Hey, Phil, what would you like to do? How can we help you? What kind of things do you need? And so that's kind of the thought that I have. So I'm kind of trying to act. Roger and I were out at the Fairbanks Street when they were abating today so that we could reach out to the campers, see what they need. I went out to, we went out to Walmart I went out to Walmart parking lot to see what they needed there. And so I've been reaching out to community councils and asking them, what do you need there? And I'll give you an example of one thing that's come as a result of this is to come up with some policies, or not policies, but guidelines, what we would hope that campers would have versus what the community council wants. And some of those would be clean, be safe, be responsible. When I heard from Rush and Jack Community Council, it says, if we just clean up these camps, that would be a huge issue. And so one initiative that I'm trying to promote is that we find some cleanup teams that are willing to go out. And so I've been talking to the city Healthy Spaces, talking to Arbor, who used to have the contract, talking to different groups. And so if we were successful, we will have cleaning teams go out into camps to support community councils in that kind of role. We also talked to Beans Cafe. They would love to get food available for community councils. And we just did that this last week. They're providing some meals for a group in the, I think it's the Downtown Community Council for it. They're doing something at Central Lutheran. The other thing that we learned is that they needed porta potties. So we just bought 7 porta potties with the coalition. And we just placed our first one. In fact, I was just there putting the labels on it under the brand of Heart, which is a thing. So we placed our first porta potty, and we have a contract for Rent-A-Can. And then the last thing we had as part of this is we realized they needed water. So with Karen Bronga, they brought up a big water tank, 330-gallon water tank, and we're using that also at Central Lutheran as a model for it. So those are some of the things that we have, which is kind of adopting things geographically, bringing resources and solutions to that area. And so that's kind of what I was looking at. And Allison had a tremendous idea, which is she had heard about, which is one of the main issues for those in camps experiencing homelessness is loss of IDs. And so there's an example of an ID program where we could record their ID and some of their documents and make it just available to them only electronically so that they could just be reprinted or accessed as well. So there's a whole gamut of things. I've met with the Department of Health. I talked to behavioral health. What can we do to get behavioral health out there? Mountain View Health Services would like to help lead an effort to get health providers out into the camps as well. So those are the kind of things, we call it a HEART, which is a Homeless Action and Response team that brings all the different resources geographically, working with community councils in these areas. And so it's just a plan, it's an idea, but this advisory council, I welcome your advice, right? Or some better plan that I should be pursuing instead. But in the meantime, that's what I have in mind until something better comes along.
Well,
Thanks, Allison.
Oh, yeah. I mean, your energy and your enthusiasm and just your, I heard today too that I wasn't aware, but that the outreach teams that are going into the camps from the coalition do have medical providers now going with them. So like we're starting to take these ideas and to find who is the best, what's the best outlet for this, right? And I do think that the outreach team and like Jess and the leadership of the coalition would be great to continue to bring these ideas, right? I'd love to figure out a way that there could be a citywide program that could help with the, the safety and the secure collection of IDs and access to it, right? It's all done on a cloud, there's just got to be, there's some things that happen to particular pockets, like that might happen to young people. Could we help make that model happen for adults? Because I know when they go in and they abate a camp, they're not sorting and saying, oh, this looks valuable. This looks like a birth certificate. Maybe they are, but I think that my experience is that they're really trying to get those camps, abated. And maybe Jessica can tell us that that's not the case, that they are able to have time to look for those items. And then what do we do to keep those items, safe for an individual? So, Jess, do you know what they do when they find that material in camps?
So, two things. The first one I will answer about the camps. It really varies based on who is doing the abatement.
Yeah.
But one of the things that we give out through outreach are these waterproof document storage pouches. And so we have made it really clear to the Healthy Spaces team, and Mike is very well aware of what they look like. So if they are abating and they see one of these waterproof document pouches, they've been pulling them. We've had one turned back into us, which is great. And we made that clear, like they can give them to us. And we will then get them back to that person. But what I wanted to say about the IDs, so last summer, we started something that I think has been working really well. So our street outreach teams, when they go out, they take a data-enabled tablet with them, and they can do IDs in the field. If that person has already had a driver's license or a state ID, you can apply online for a replacement. And so we're able to do that with them. And then what happens, what that process is that usually 2 days later, they will email you the temporary ID, and then they will mail the permanent ID. So they can have the ID mailed to us, the temporary ID emailed to our client email. We have a client email account. And then we have been putting them in HMIS. So asking them, would you like your scanned copy of your ID, your temporary ID, put into HMIS? And so then that way, if that person loses it, they at least can get a copy of it. And we're able to do that with the permanent IDs as well. We could do that with birth certificates. All of those are things that copies of the documents can be kept in HMIS. And then they could just go, to the navigation center and ask to have a copy printed out, or come to our office and have a copy printed out. So slowly but surely, we've been getting some of those documents in. And then as we have been working with people, getting them housed, we've been doing the same thing. All of their critical documents are in their HMIS record. So as we're getting them to be able to do the housing resources, whether that's a verification of disability, whether it is their ID, their birth certificate, their social security letter that shows their benefits, any of those like kind of critical documents we've been getting in there as HMIS attachments.
That's great. I mean, I think that if we keep thinking and keep bringing these things forward, right? Like each of us has a little different ability to add on to the contribution, right? I know after Kenny talked to me, I started talking to my Midtown group. Like, okay, what can we do? Do we want to adopt, this camp? Do we want to, is there a way that we can do it? I know that they also, in addition to the cards that they're leaving at the camps, the coalition and the outreach team have it's kind of like a teal blue bag that kind of lets you know that, this space has been, the coalition has been here. And these are kind of a collection of items. So each time we get a little more action and more direction that is available as we go out and kind of manage the street outreach on the various camps. So does anybody else want to bring anything else forward?
Oh,
I think-
say, Allison?
Yeah,
Oh, sorry, whoever else is fine.
Yep.
I think
Whoever is next, I'll wait.
Janae also wanted to provide an update, I believe.
Yeah, I don't care who goes first.
Go ahead, Janae.
Okay, I just have a couple things. So I think everybody knows who I am on the call, but I'm Janae Gray. I'm the HMIS director for the HMIS lead, Institute for Community Alliance. Usually Kim is at this meeting, but she's actually on vacation. And like Allison said, we don't blame people for traveling in the summer for Alaska. So I just have a couple updates I wanted to give you guys. The AK HMIS advisory board did meet this week. And so that's the governance over both of the COCs since we have a shared implementation. We are going to be sending out, when I say we, Holly Blood, we'll be sending out, she's the secretary, we'll be sending out information on the government's document reviews. This is the third year that we've done this way. And so it won't be foreign to some of you that have been around. It will be a little bit new for those of you that are just joining the board. So there will be information in the email of how you give feedback. And then ICA will be collecting all the feedback that we receive in a shared space. And then we'll be bringing that information to the AK HMIS advisory board, the larger board, to review if there's anything that needs to be updated in those governance documents. The current governance documents are posted on our website if you want to, get a head start and look at those if you haven't. If not, that email should be coming out within the next, since next week's 4th of July, I think we said the 8th or 9th is the deadline that we wanted to have those out. We did a in-person training. This was our first larger in-person training in Anchorage since COVID, and it was really well received. So we would like to try to get out in a couple other communities, not just Anchorage, to do some in-person training. So we are working on that. I know that Kim's working on a couple areas that's drivable for her and Daniel to be able to go to do some HMIS training. For the point in time count and the housing inventory count, those numbers were, of course, submitted to HUD. We are working on some follow-up questions. Jessica and I have been going back and forth to just try to get the email from HUD with those follow-up questions. We finally did receive that today. They were actually sending it to Cecilia, who hasn't worked for the Clabber applicant, of course, for a couple of years. And so we finally got that figured out. So we'll be working on that follow-up from HUD. It's a normal thing that happens every year. I just wanted to let you guys know that that's happening. And then I can't talk about HMIS without talking about funding. We are doing a 2-month extension for this. It's not really an extension. It's a 2-month contract based on the funding that we've already got secure for this next year, which is around, it's $378,500 and some change is what we've got secured. And our budget is well above that. And so we are still looking for additional funding. I know that there has been some additional funding that was received through the state that I know that Meg and Jessica and Brian and Helen and Holly will be working on to get the HMIS piece budget line item figured out for that. And then we have had a conversation with the Anchorage Health Department. Myself, our ICA CEO and COO, and then Jessica and Meg met with them about 6 weeks ago, and then we've had a couple of follow-up calls ICA has with them. So I'm hopeful that maybe something will come out of that, and that conversation is still continuing. So I just wanted to give you an update of where we're at with that, and any suggestions, any opportunities that you guys hear of, let us know, because we would be happy. I'll be happy to write any grants or talk to anybody about AKHMIS and how it's important to collect that data on our friends that are experiencing homelessness, because if we don't have the data, we don't have the story, and then the funding is not going to come to the state. And so just send me an email with any of that information, and I would be happy to do that. And that is the few updates that I had from ICA. If you guys have any questions, just let me know.
You want to go back to Kenny really quick, or do you want to go to you, Grace?
Sure. Actually, Kenny, do you mind if I ask a quick question?
Please feel free. This actually ties right in, so keep going.
Sure. Janae, I'm a highly visual person. You might remember. I
Yes.
would love to see these numbers on paper if at all possible. I would love to help brainstorm what we can do and kind of see what the gaps actually look like, and then where the support is coming from, so that we might be able to have a little bit more information in order to do that brainstorming for you and really tap into the community. So, I love it.
Why don't I send you, Grace? I can send you I'll just send you the budget that we had sent out with the contract. I just sent it out, the 2 months contract this week, and it has the guaranteed funding that we're receiving from the match funding from AHFC, and then the HUD COC funding. That's the guaranteed funding we have, and it lines that out for Anchorage to balance the state. And then it has the budget of staff, travel, administrative cost, and all that broke out also. I'll send that out to you, and then you can distribute that as needed.
Sure.
If that'll work. Is that what you're talking about?
Yeah, and I'm happy to look for it too. Like I had it. I'm happy to send it out to the council, so we all have that.
Okay.
kind of
Yeah.
information.
Yes. Okay. I can send that out to you too. I can send that to you, Alice, and then you can distribute. That'd be great.
Yeah.
Some of the priorities that I would like to see that would help me understand is just the gap specifically, source funding, and then the timeline for which we need to establish additional funding streams. And so those 3 things are the priority for me that I would like to see. But yes, happy to distribute it however we want, whether through Allison or Janae.
Yeah, if I can find mine, or if you send it to me, I know that I'm happy to send it out to the council. It's
Okay.
good information for us all to have as we think about
Absolutely.
funding, the information, some of the responsibilities that we have over the COC money.
And then just additionally, it seems often that this conversation happens towards the end of the funding cycle every year. And just like the rest of our work, I would really like to be more proactive about this. And so if we could have regular updates on our HMIS lead needs, that would be very much appreciated.
Yeah, no problem. No, we would be happy to give that. And I will just say, and I'm going to give a shout out to Jessica and to Brian. We have been meeting about this, Jessica. I think the first time we met this year was January to brainstorm and have a conversation. So Grace, I 100% agree with you. It's always like, and this is my 4th year as the HMIS director over Alaska, and every year it's been this way. So and if anybody is having a heart attack about this, it's me, because this is the staffing and the software and everything that we have worked so hard for. So we have been meeting a little bit earlier. It does need to be a conversation constantly because we are at the end of the grant cycle. I mean, this contract year ends June 30th. And so we have that 378,500 and some change that will be able to carry us for a couple, 4 or 5 months, but then that's it. And so it's like we always are in this situation. And then the thing is like you guys know, is we're not getting sustainable funding other than that $378,000 every year. So it's like like last year we got $160,000 from some ESG funding that should have went to the coalition. And then we ended up getting it because we're the HMIS lead with Jessica's help. And Meg's help on that. And so it's like the sustainable funding is what's important. And so we're not doing this every year. So I'll be happy to give updates, myself or Kim. I can always, send out a little thing every month of just where we're at, where we stand at. And then Grace, I will get you that information, out to you or out to Allison. I'll probably be able to send it out tomorrow. And so I'll get that information to you guys. And Kenny, I've never met you in person, but I just want to say that you're a rock star. And we need a Kenny in all the COCs I work in. So I just really appreciate the work that you're doing.
Thank you.
Okay, Kenny, flattery will get you everywhere, right? We're flattering Kenny. Keep doing it, Kenny.
Yeah, no, if she only knew this is only for my mental health, it's like, I should go have like a mental health breakdown, or I just go do homeless work. Well, I don't have time for mental health breakdown. I guess I'll, so it's purely selfish.
Let's do something productive. We don't want you to break down.
Yeah, that's right. I just wanted to just give a context thing. And so this might be in the weeds and you're like, yeah, Ken, of course, we knew this already, but I didn't. So I'm really excited about it. About a year ago, everyone was going, hey, we got to wait for the state to do something. We need money. We need leadership. What's going on with Alaska Council of Homelessness? What's the governor's office doing? So I was curious about that question. So for the last year, I've been trying to find out who's leading homelessness at the state. And I've gone many different routes, and Kim Koval, and then the Alaska Council on Homelessness, and Michelle Overstreet, and then Brian Butcher, and Brian gave me a vision of things. And so I just this week met with Heidi Hedberg in the Department of Health, and with her team, with Bob Lawrence and with Gene Wiseman, who many of you may know or not. And she says, you know what, we asked the same question, who's leading? And so we decided, well, we in the Department of Health, the Department of Alaska Housing, Mental Health Trust, and one other that she listed, she says, we came up with a plan and we've been trying to implement it for the last couple of years. So we've got some staff hired, we have a data plan, and we have a vision of where we need to go in order to help make strategic decisions. So I was really grateful that they said, yeah, we and a couple others, we've been talking about this. And there's some things we need to do strategically that will be in a place to be better able to respond to homelessness in the state, which includes us. And I says, well, what can I do to help? What do you need me to say? He says, let them know about the Health Information Exchange. And she says that whatever that is and whatever that means to them, he says, tell people about it. And what I understand, it's a database that health uses, but they'd like to do it with because homelessness is a health issue in many of our minds, and housing for health and so on. So as it interchanges with HMIS, when they're looking at someone who comes into the ER or somewhere else, that they'd love for it to interchange with HMIS so that they can find out which caseworker should we call as we discharge or as we come up with a plan. And so there's something about this, the Health Information Exchange and its connection to the HMIS, that she thought was very important for the homeless work at the state level to support whatever she visions coming next. And so I just wanted to say that if you look that up, you'll end up with Health E, the letter E, exchangeak.com. And anyone who has a business reason to look at it can get access to it. But so in data or in prioritization or wherever, and maybe, Janice, boy, I don't know if I said that right.
Janae, it's fine. No,
Janae,
you're fine.
Thank you, sorry. Maybe Janae knows all about this because she says we have been having conversations about how we can tie our data in. But the advisory council here is really the place that would say, yes, we really want that. So let's prioritize it. What can we do to make it even more available? But so I just want to make that connection, and you can learn more about it. And Mitch, thanks for putting that in the chat for it. But she really wanted to say that if you're looking for solutions at the state level, let's promote this and then go to the next level as well. But Heidi was great to meet with. So just wanted to promote that.
Yeah, and just to follow up on that, Allison, we have had some conversations, and then they were working on sending us, and Jessica, you may remember where we're at with this, but I know that Kim's been working on it, but there was some privacy issues that HUD has around HMIS and how we share data. And so that was the conversation that we were having, going back and forth, and then having a conversation too around funding and what that would look like, because there is funding available in that area. And so that would be somewhere where we could get some of that additional funding also. So we have had conversation. We have been in conversations with them about getting some of the HMIS data in there, or they're getting some of their data in HMIS, or both. And so, so just to let you know that has been part, and there's been other communities that have been able to do that. So it's totally doable.
That's a great puzzle piece to put together, Kenny. I'd never even heard of that. So thanks.
It sounded important, so I'll keep abreast of it. But
Yeah.
whoever can encourage HMIS and bring resources and prioritization to HMIS to, if it's a good solution, that we keep an eye on it till it happens and whatever's needed. So
Yeah. Thanks. How about Jessica?
All right, I have so many things, and I will try to keep them really short, because I know we have some other discussion that we wanted to have today. I do want to share, we have been having those ongoing conversations with the Department of Health about data sharing around that. We've had some discussion at the data committee as well, but did just want to share and echo what Janae said. There is a cost related to that. And while there is funding at the state level to help support that, that funding is all part of the governor's initiative, the People's First Initiative, which is ending with his term. So we want to be really careful that we don't bring something into our system that we are already spending resources trying to find resources to pay for without sustainable funding to continue with that, because we certainly don't want to start doing something and then, you know, pull the rug out and be like, ha, never mind. But we did get to do a one-time partial data match where we were able to take some information from their system on who is enrolled in Medicaid, just a very simple data point, and look at HMIS, because when someone is entered into coordinated entry, one of the questions that's asked is, does this person have health insurance? And if so, what is the resource? And we did find that that data is very incomplete in HMIS. So I don't know if that's just a question that people skip over, or a question where if someone's like, I don't know, we don't spend any time, we just keep going. So we did find that there are definitely gaps. And we want to think about creative ways where we can get more complete information. And this is one avenue that that we could be taking. So government updates very, very quickly. The governor is set to sign hopefully a budget today or tomorrow, because that's the end. So we should know something more on that really soon. In terms of federal, initial committee budgets have been released. I'll be in DC, not next week, but the week after that, with Meg for a National Alliance to End Homelessness conference. And we have Hill visits scheduled with all 3 delegations as well as HUD offices. So we'll be sharing a lot of the information that we shared this morning down there, and then bringing, as always, the message of Alaska really needs to receive our fair share of funding. I'm going to share my screen really quick because I want to walk through a couple of the documents that Allison was mentioning, and then I will share that out via email.
May I interject real quick? The next agenda item we have lasts for about 20 minutes.
Ooh, okay.
Can I push that? Can I request that we push it till the next meeting so that Jessica can give us full updates?
push that. not
Yes,
mine.
not yours.
Push the retreat to the next
The
meeting?
retreat
Yeah.
update, so we can give both of them full time. Do I
Yeah.
need to make a motion to do that?
No, I mean, I don't know. Who knows Robert's rules? Grace, I rely on
Aaron.
you to know my Robert's rules. No,
Aaron's better than I am.
I think we
Uh,
can.
What was the question? Do we need a motion to extend the time?
No,
No, a
no,
motion to push an agenda item to the next meeting table.
Oh, I'm sorry. Yeah, I was focused on ICD codes.
Yeah.
And mostly I was thinking, I want to watch this crazy debate that starts in
Yeah.
12 minutes. So,
yeah.
presidential debate, I mean, unless I need
yeah,
to elaborate on that.
Oh, not this one.
No, I don't think, I mean, I think
Okay.
someone could make
friendly-
a motion
Yeah.
to push that till the next meeting. So I'll
I
make such a
motion to
motion
push.
Yeah.
Yeah.
to move the item in question to the next meeting.
Then I second.
Yeah. Thanks.
Objection.
Okay, you're on, Jess, still.
All right. And then I do just want to highlight, if you didn't see it in the meeting chat, Sharon did bring up the point, the cost for bringing in the medical data. That there would be emergency department resources needed to record some of that information. And so if there is funding, we want to make sure that we're properly funding the emergency departments to do that at the hospitals as well. Because we receive enough unfunded mandates, we certainly don't want to put that on
Yeah.
someone else. So making sure we're understanding all of the costs related to a data sharing agreement. So this first document is something that I updated today. I've created in the past to be able to share information with our federal delegation. So I updated it, including 2024 numbers now. But one of the big highlights is that over the past 7 years, our COC, if we exclude the YHDP cohort, which came in, we have seen less than a 1% increase in our annual renewal demand. And the CPI over the same period has averaged about 3%. So this is our annual renewal demand over the years. And then, of course, highlighting that right here is where YHDP came in. So really that jump right there is attributed to all of those grants coming in. It's not an increase in the resources allocated through our annual renewal demand. You'll see that in fact, through 21 and 2022, we saw our annual renewal demand go down. And that was a result of when Awake gave up their grants. And so we've been building back, and you can see that it wasn't until the 2023 grant that we were back to growing again. So to highlight with that, it's really important that we take advantage of every bonus opportunity we can that comes through to our community. And if we have grants that we feel as a community might not make it, that we're having a conversation about reallocating those funds and not just giving them up. Because when we give them up, we have to start all over trying to bring them back into our community versus if we're able to reallocate them. Awakes was a little bit tricky when you're reallocating funds that were to a DVSA, a domestic violence or sexual assault organization. It has to go to another one. So that would have been really tricky to navigate, but we're excellent at navigating tricky situations. So I highlight that frequently for people that if you follow our CPI increases versus our grants, what we've actually seen is a decrease in the spending power of our COC funds.
Can you clarify the term CPI and ARD, please?
Consumer Price Index. So if we look at the cost of doing business, the cost of buying the things, the cost of paying the people, that has gone up dramatically while our grant has gone up very tiny little bits.
Inflation.
Yep, yes. And then the second thing that I like to highlight is our point in time count information, because HUD feels so strongly about this. And so what I have in this chart is our point in time count numbers from 2016 to 2024. And then overlaid with our total numbers, I have our unsheltered count And then a green line designating how much of our shelter is seasonal shelter. So how many beds of seasonal shelter beds? And you can see that while we saw really large increases in people experiencing homelessness in 2021, 2022, and 2023, we also had increases in seasonal shelter. And so that's the Sullivan Arena and then the non-congregate cold weather shelter that opened up. In 2023, we saw that number go down dramatically because we closed the Sullivan Arena, and the only cold weather shelter beds we had at that point were the 56th Avenue shelter and the Alex and the Aviator. But we still had large numbers of people experiencing homelessness. So now we have seen our unsheltered number go up. So that's really to highlight here that as we do the point in time count and we do the housing inventory count, people will look at that and say, oh, well, you've got over 1,000 shelter beds. But we try to highlight so many of those beds are seasonal beds. They are not year round. So if you were to do the point in time count in the summer, you would see something very different. And then the last thing I really wanted to highlight is that since we do have disproportionate increases in the funding that our COC gets, that means that grantees either have to reduce the number of households that they're serving, because you can't continue to pay staff living wages and wages that are competitive to keep them and still serve the same number of people. Like something has to give there. And so what that does is it increases the length of time people spend experiencing homelessness before they get housed, because there are fewer resources available to them. And that is one of the biggest drivers in our collaborative application when it comes to points that we lose out on. And we've talked about that here before. And then this last chart is super timely with this conversation about HMIS. So you can see that the yellow portion is what is being funded into our HMIS system outside of the HUD grants. The HUD grants have been the exact same amount for the past 5 years. In early 2019 and 2020, the amount that the contract was fairly similar. There wasn't a whole lot going in outside of the HUD grants. It was just the AHFC matching funds that come in. But in 2020, we expanded the services that were being offered in our HMIS and the ability to capture more data. We have many more providers using HMIS now that are not required to from their funding. And so that is resulted in the past 3 years of having substantial grants and funding coming from the COCs. And this is statewide. We have a statewide system. So there's no, here's the anchorage, here's the balance of state. It's one big system. And we both COCs put money into it. So over the past 3 years, we've had pretty substantial contributions through one-time funds. Whether that was COVID funds that were available, or as Janae was talking about, there was a 1-year allocation of ESG or Emergency Solutions Grant money that we were able to get allocated for HMIS, which was originally coming to the coalition, but then when we transferred COC lead to ICA, we redirected those funds to go directly to them to fund that. So going into this contract, we don't have any of those one-time funds anymore. And so we're left with a funding gap that we need to make up. And this really highlights that part there.
Can I make a comment real
Yeah.
quick? Sorry. 2 things I'd like to explore. I'm looking at the time. We only have a few minutes. Just examine what it might look like to do a pay to play for utilizing. I would like to see the numbers and sliding scale based on different institution or organizations, funding streams or what have you. And then also explore whether or not today, but whether or not we can get more from HUD, and if so.
Yep, so I'll say the only way to get more from HUD is to reduce, it comes out of our annual renewal demand. So we would reduce the amount of funds available for program grants and increase the HMIS grant. So that is a possibility. When we were exploring what the cost of user fees would be before, if we took the total number of projects. So there's two different ways you could do that. You could do users, which is the individual users into the system, or you could do projects. So regardless of the number of users at an organization, each project would have a fee. And I believe, if I remember correctly, the math was working out to somewhere around like 12 or 13,000 per project.
That sounds about right, Jessica.
Yeah, I feel like that's where the math was
Yeah.
mapping out. But I think what that would do, it would make organizations that are not required to be in HMIS be like, well, see ya.
It doesn't have to be an all or nothing, and this is something I'd like to explore next time,
Yeah.
but it could just be a partial
Mhm.
support.
Yep.
And I'll just add to that too, and I'm not sure, Jessica, if you said this because my dogs went crazy just a moment ago, but is that agencies can write HMIS as a line item for their federal grants that could cover that cost. And so that is something that I don't think is explored as much in Alaska as other COCs in other states, but that is something that is a line item in ESG, YHGP, PATH, all the federal grants that are received from HUD, COC, that can be a line item for agencies to write HMIS in that could cover that cost for agencies.
Yep. Yeah, and at the retreat, we were talking a little bit about that too, and I see Laura in the chat. That is a way that HMIS used to be funded. That the grantees would write in, like their portion. And again, that would be the conversation about how would you structure that so organizations that don't have to participate, still feel like they want to, or feel like they should. All right, well, I took us right up to 5 o'clock.
You
But
did.
I really just wanted to share that those are a lot of the conversations. I think Allison actually did a really good job of talking about some of the nuances of some of these conversations, but these are those high level. We're really advocating every time we have the opportunity to talk about how the funding that comes to Anchorage is just inequitable. We have a population in our Anchorage COC experiencing homelessness that is almost exactly the same as the Houston homeless population. Houston receives just over $40 million into their COC. Our annual renewal demand is just over 4 million. So 10% of the money. And the other side of it is that the Alaska Public Housing Authority doesn't have a statutory set aside for people experiencing homelessness. So when there's vouchers, when vouchers are available, everyone is competing like all together. There's no preference. There's no like set aside for that. The set asides that exist are for project based vouchers, and those projects might be serving people experiencing homelessness. So in Houston, they have almost half of the vouchers that they have available are set aside. So their COC funded projects are able to be used more for the supportive services and less for the rental assistance because they have another source of funds for that. They're able to do almost a 1-to-1 match. So it frees up the resources to be able to serve a lot more people with the COC funds. So.
Yeah. Thanks, Jess. I know that we are at 5 o'clock, but I do want to make sure that we have any last minute questions or any good news that we want to come forward to the group for the good of the group.
Allison, Janae, I just wanted to tell you I was going to get you that information tomorrow. I don't want to cut myself short, so I'll get it to you early next week. So
That's
I
good.
just realized it's Friday tomorrow. I thought today was Wednesday, so I
Yeah.
apologize.
Yeah. No worries. Any other good news?
Just feeling real hopeful and energetic with all the work we're doing. So thank you,
Yeah.
everyone.
Well, and if anybody needs any comic relief tonight, yours truly is playing once again softball with a team that we are the officially known as the Bad News Bears. So Covenant House is out there. Carty field number 3, I think, but 6:30. I don't have anything else funnier for anybody to watch than me playing softball.
Well, I have one quick piece of good news slash celebration. I've talked a lot about the next step, and I've talked about how our goal over the summer is to truly operate that project as intended, which is housing people directly out of encampments and decommissioning encampments to do it. So our first camp is Jacobson Park on 36th Avenue in between the highway and Lake Otis. If you've ever been in that area, it's the north side is where the encampments are. And the 13 occupants of that camp are all being housed in the next 10-ish
Oh my
days.
gosh.
And so there was an abatement posting for that park today, but every single person in that park is moving to housing.
Wow.
So that abatement is not whack-a-mole, move somewhere else in town. They will be going to housing.
Incredible. Yeah.
Watch our social media. There's some pretty incredible stories out of that, including
Very
a
good.
picture that made me cry of someone
Yeah.
crying while they hugged an outreach worker saying, "I cannot believe I'm going to housing."
I can't wait to cry when I
I
find
know,
this.
I know. Oh, so many
Don't
cry
worry, you
stories
will.
the past few days. So that is my celebration slash good news. And just to share the CAP team with APD who post those abatements, they had such a heartwarming experience out there doing that, because I think it's really easy for us sometimes to look and say, you know, we're the people who are doing the work and housing the people, and they're the bad guys that are posting the abatements, but we're all people. And their team to be able to be posting those signs, but also knowing that every single person that they're having that conversation with is going to housing, was so heartwarming for them to experience. So I'm really happy that the Parks and Rec team and the CAP team got to experience that with us as well.
Awesome.
That's great. I can't imagine topping that, but I'm sure someone can. Any other messages? Okay, well, everybody have a safe and enjoyable night. Look up to the sun, get some vitamin D, and everybody keep the energy that Kenny has.
But don't
Okay.
steal my Kenny.
Yeah, yeah. We have a whole group of Kennys on here. What are you talking about?
Just so you know, Jessica went out with me. She let me go out to the parks with her, so that's great.
There you
So
go.
I'm
This is
not
being
alone.
recorded.
You're not alone. You're definitely not alone, Kenny. Okay, thanks, everybody. Have a nice night. Thanks for joining.
Bye.
Bye-bye.
Take care. Kenny, what we do in secret.
You're hilarious.